We are checking for the tray extensions in the maxillary arch now. Reflect the lip and perform some movements so that the tray doesn't get displaced when you're performing labial frenal movements. You can lift the cheeks at 90 degrees to the occlusal plane and check for extension. You can always pass your finger and check for space for the bottom molding material. Similarly, you have to check for the movement of buccal frenum by moving the lip anteriorly and posteriorly. On the other side also, verify it. We are going to do an incremental bottom molding technique, starting with labial vestibule first, then the buccal on both sides, then the posterior palatal seal area. And we are going to use the low fusing impression compound. Heat the material slowly by rotating the stick. Let the material flow in. Try to control the material and adapt it on the tray. At this stage, you can always shape it with your moistened fingers. Temper it in warm water. Insert the tray carefully in the patient's mouth. Go behind the patient and pull the lips downwards and gently massage the upper lip and let the material set. The tray is dried. The softened impression compound is added. You can always shape the borders with your fingers first. Temper it in warm water. Insert in the patient's mouth. Support the tray with your right hand. When you're doing on the left side, pull the lip and cheeks outward, downward, inward and forward and backward to record the buccal frenum movement. And at this stage, you can also ask the patient to move the lower jaw to the left and right. Jaw left and right to record the coronoid contour. Now you can see now we'll be recording the posterior palatal seal area. Depending upon the compressibility and the space between the anterior and posterior vibrating line, add the material. Temper it in warm water and fold it against the tissues by applying gentle pressure. Check the material has flown in the posterior into the hamular notches by palpating with your index finger on both sides and let it set. Once the material is set, try to check the retention of the tray by pushing the handle upwards. If the retention is good, the tray will be displaced after sufficient force is applied. Here you can see the tray is having sufficient retention, the bottom molded special tray, anteriorly as well as posteriorly. Any excess material that is flown into the inside of the tray is cut with a sharp blade. All the segments of the bottom molding are again heated and smoothened, and the bottom molding movements performed. Excess material is trimmed from outside the tray. Always use a very sharp blade to cut the material. You can see the reflection of the buccal frenum here on both sides, and the labial frenum, and all over you can see the matte finish of the bottom molding. Now we are going to flame the borders again and fuse the segments, tempering in water again and placing in the patient's mouth and performing all the bottom molding movements once again to get a uniform single border. Verify the retention again at this stage. The tray should not fall down when you are performing the movements. The tray must be retentive at this stage. It should not drop when you are performing the bottom molding movements and when the jaw is moved to left and right. The labial frenum has been recorded and rounded labial vestibules. Extend up to the retromolar pad area. Reflect the lip on the opposite side. Rotate the tray, place it in patient's mouth and perform bottom molding movements by pulling the cheek upward and inward. At this stage, ask the patient to apply some biting force and resist it with your fingers. This is how we are recording the mesenteric notch and the buccal sulcus. On the other side, and inserting the tray carefully, supporting with your fingers and performing the bottom molding movements. Bite, resist the biting force. Refine this testimony.
లింగో చేసేస్తున్నారా సార్? ఓకే. నేను ఇది రీఫండ్ చేస్తున్నారేమో అనుకున్నాను. ఫోకస్
డిస్టెన్స్
డిస్టెన్స్ కేజీ
recorded and I can record.
Yeah.
Now we'll be body molding the lingual flanges. First in the anterior segment, add the material carefully. When you are doing the mandibular anterior body molding, ask the patient to touch the tip of the tongue to the upper lip and swallow. At this stage, when the patient is lifting up the tongue, the tray should not be displaced. We are going to do the middle and distal part of the lingual flanges. Place the tray in patient's mouth and check whether the material has flown into the vestibule with your index finger. Gently push the material into the sulcus and ask the patient to perform tongue movements. Take the tongue out, left and right. At this stage, we are going to record the lingual flange on the other side. Temper it in water. Carefully insert the tray in the patient's mouth. Check the material. Take the tongue out. In, left, right. When the patient is performing tongue movements, the tray is stable. That means our lingual extensions are good. It's not overextended. And we can check the retention. The tray is showing some amount of retention when you're pulling it up. For the posterior side, you have to try to lift it from the back. So with the resorbed ridges, you will not have very good retention, but I would call this a fair retentive body molded tray. Now we'll modify the distal lingual flange areas on both sides. It is a pouch like area, so you should be recording it, and the borders are very thick, and these borders are very crucial for your denture retention and stability. Take your tongue out, in, left and right. Material in the retromolar pad area and compress the tissues to aid in our retention. And also flame the distobuccal areas again to record the mesenteric notches. కొరకండి. Now we have completed the bottom molding. Any excess material that has flown inside is trimmed, and the borders are refined again, and to get a smooth border all over. You can see the labial frenum depression, the buccal frenum here and here, and the S and reverse S shape of the lingual flanges. Now we are going to remove the spacer very carefully, holding the tray securely in the palm and thumb. As we have put the tin foil there, it becomes easy to remove the spacer. You can see the tray is clean now. Now we are going to make holes in the tray and finish our wash impression. The completed mandibular final impression. This is a completed maxillary impression.